Hello, Right at Home caregivers. It's Phil here with another edition of the Caregiver Corner. I want to talk to you a little bit today about the COVID vaccine, which is now widely available for us here in Ventura County. We are essential workers caring for the vulnerable elderly, and I strongly urge everybody to get the vaccine. It would be a great idea to do it. You're protecting yourselves, you're protecting your family, and you're protecting your clients. And in the society, we need to get enough people vaccinated so that we can get what they call herd immunity and reduce the level of the virus. Thinking a lot about our new normal, what it's going to be like 12 to 24 months from now. And I think that we're going to be wearing our masks for a long time. We will be socially distancing, washing hands, disinfecting services for our protection, even if we've been vaccinated. But it's just a minor inconvenience for us so that we can protect those people who are vulnerable to the vaccine. And once we get everybody vaccinated, some of those restrictions may begin to ease up. I see the decision to get the vaccine as a matter of balancing risk. One thing is for sure, is that if you get the vaccine, you will be much more likely not to suffer the effects of the COVID-19 virus should you get it. And that is enough for me to want to get that vaccine. Some people are a little bit nervous about it. They've heard stories that it can affect their DNA. It does not affect your DNA. There's some other things that I've heard as well. People are just nervous that it's not been tested well enough. Well, in the clinical trials to get it released, it was tested with over 15,000 people with a wide variety of ages and ethnic backgrounds and health conditions. And they've determined, at least in the case of the Moderna vaccine, that it was over 94% effective, and the Pfizer vaccine being 95% effective. So it really makes a lot of sense for everybody to get this vaccine. I really enjoy listening to podcasts, and I listened to one recently with a fellow who is the leader of the scientific team on the government side to develop the vaccine. And the story behind the vaccine development is just fascinating. They use technology, the messenger RNA technology that has been in the works for many, many years. And they were able to use this technology to develop this vaccine quickly and safely and effectively. So I'm going to put a link to that podcast below if you'd like to listen to it. It's called From People I Mostly Admire, and it's a great story about how this vaccine was developed. I'll put a link below to another video that I found to be very interesting, and it's from Moderna, and it talks about the vaccine, a little bit about how it works and its safety. So I'd encourage you to do all of your research that you need to do. The CDC has a great website that talks about the vaccine and what's important, and so I'll link that below as well. So I want to provide you with as many resources as possible, trustworthy resources, so that you can understand the risks and the benefits of taking up the vaccine. So what's it like to get the vaccine? Well, first you have to register, and I'll talk about that right now. So let's go through the registration process for getting the vaccine. So I'm going to go to the website VenturaCountyRecovers.org and go there. And it provides you with a home page that tells you everything you need to know about COVID-19. How many people are tested, where the testing sites are, and for vaccination. So let's take a look at how to get registered for vaccinations. You see here is a phase 1A, tiers 1 through 3, vaccine registration. You are in tier 2 as a home care worker. So I'll click that. And it provides you with a lot of information about the vaccine itself and the process for getting vaccinated. So you read through everything that you have here, and you will need to bring your badge with a picture to show that you are a home care worker, but that is all that you'll need. In order to register for the vaccination appointment, you need to select your sector, and you are home care and home health. Let's see. Home health care staff and in-home support services. You click that. And then you select the dose that you're hoping to select the appointment for, either it's first dose or second dose. I'll say first dose. I understand. Please continue. And they verify that you are really eligible to receive the vaccine, and you can check for availability at certain areas: South Oxnard Public Health, Ventura County Fairgrounds, the Global Adult Communities, and these open up all the time. So I would, if you don't get the appointment date that you would prefer, I'd say come back the next day, keep looking, be very persistent, because I've seen as they get shipments of vaccines, they open up hundreds of slots. So they schedule them basically 2 weeks in advance. Even when it says no appointments available, take a look at it. I have heard, and there's all kinds of information on this website. So you take a look at it and go ahead and register. Once you've registered, you'll go out to the fairgrounds, and fairgrounds or whatever facility they direct you to, and stand in line. I found them to be very well organized. It wasn't always as quick as I would like, but it was well organized. Everybody was polite, and everybody knew what they were doing. So that was really promising. So after I got the vaccine, I came back and sat in an area where I waited for like 15 minutes to make sure that I did not have an allergic reaction. I really do appreciate the oversight that they have of that. And then I enrolled in a program called V-Safe. And V-Safe is a program from the CDC, which is going to track how you're feeling for several days afterwards. They send you a text message and ask you a couple of quick questions. And if you've been sick, and have you missed work, and how do you feel, so that they can track the side effects of the vaccine. And the more people that participate, the better. After you've gotten your second dose and you've been vaccinated, you still will need to wear your mask, do social distancing, wash your hands, and be cautious about being able to spread the virus, because having been vaccinated, it's not likely that you're going to get this virus, but you can still spread it. So we all need to be careful and need to be on the lookout. So if you have any questions, call the office. We'll walk you through the process. If you need to use our computers, you can come in and use our computers to register if you don't have one. We want to help you to get through this process so that it's easy, and we want to get everybody vaccinated to protect yourselves, your family, and our clients. Well, I'll see you on the next Caregiver Corner.